Hi, and welcome to the In Circulation podcast, where we talk about innovations and new trends that we're seeing in cardiology. My name's Michelle Wimberly. I'm here today with Dr. Amit Amin with Cardiovascular Institute of the South. He's an interventional cardiologist. Dr. Amin, you want to take it away? Introduce yourself?
As Michelle said, Dr. Amin, I've been working with the practice for now 8 years. I trained under Dr. Walker as a peripheral fellow for about a year-ish, and then transitioned over to the full-time practice. Specialized in peripheral artery and venous disease, and it's been a great 8 years of learning.
So tell me, what brought you to our practice at CIS?
So I trained at LSU, and I was coming as a fellow to Lafayette to work with the CIS guys, and so I got to know them very well. And at that point, the fellowship was open. I'm from the East Coast, so it was either going back to the East Coast or staying around here. And it was a discussion that my wife, Jen, had about staying here or going. And she was like, you're not going to be doing this ever again. If you get a fellowship, you should just get it done. You're not going to go back. So I was like, okay, fine. So there was a decision. It was a tough decision, but we made it. And it was probably the best decision to work with Dr. Walker. That year was unbelievable. Dr. Ingrati was one of my mentors when I was a fellow. And he was a big proponent about me staying. And then some of the other fellow partners that I have right now, Dr. Ayalor, and some of the others were becoming good friends. And they were like, you should consider it.
So what do you think has changed over that time in terms of new fellows or any physician who's looking for a job? What is the driving force of them making decisions these days?
See, a lot of it initially when I was looking at a practice was the whole camaraderie. The biggest part was the camaraderie amongst your peers.
Of course.
And who you work with. And if they have the same kind of goals and aspirations and dreams and mentality, that was the big part for me. So when I was in fellowship, I did see something that I didn't like, and I knew I wanted to stay away from that. And so working as the fellow coming to Lafayette from time to time, I saw how they were operating with each other, how they interacted, how the spectrum, they're all young guys with some senior guys, and it just felt right. And I think a lot of that was just, you have to do your interviews, you have to do your due diligence to figure out what practice is good. And at the end, it just felt right. Yeah. Lafayette was a beautiful town for us, good place to raise the family, and it just aligned that I had everything that I was looking for, so it just fit for us.
I like to say that you have to find a place where you check the boxes. And so I think you just spoke to that in terms of culture, everything just checked off. And I think at the end of the day, a lot of the physicians that I talk to are looking for call and compensation. And it's so much more than that. And I think you just described that very well.
It is. We all get blinded or swayed by the dollar signs, but it's not all about the dollar signs. You have to think about lifestyle. And the lifestyle was the most important thing for me. I've seen historically some older cardiologists, not from our practice, but in general, who spent too much time in the cath lab or just buried in paperwork and they don't see their kids grow up. And I really wanted to stay away from that. And that was another drawing factor for me, that I could get home and see my kids grow up, go to the soccer games, karate lessons, whatever I needed to do to take them. And that was very important for me. And to have that in this practice and to be able to see my kids grow up, spend some time with me, my wife, go on vacation, stuff like that. That was more important than the dollar signs for me.
So we talked a lot about what attracts physicians to a practice and what makes people stay. We know that within that 1 to 3 years is when a lot of physicians will transition to another opportunity. So what do you think is the driving force?
For me, it was your family has to be happy, number one, right? Make sure your wife is happy where she is. Easy access to family if she has to travel. It's a safe place to raise the kids. The schooling system's good. All of that stuff makes a difference, right? That's number one. Number two, how the practice is designed. We're a physician-based practice, physician-owned practice. And so it helps to have like-minded people in there. With Dr. Walker leading the whole spirit behind it, the innovation side, so you get to, as an interventionalist, having access to all the new tools and stuff like that is very important, because it makes you feel right now on the forefront, and you can do the best for your patients. So that helps, and then you're just changing the paradigm of PAD or of venous disease in general for me, because that's what I concentrate in, and so it helps a lot.
Yeah, I think you touched a little bit about having the support around you, and I think if you want to talk a little bit about that, because that also will contribute to burnout when you don't have that.
In clinic especially, we have all the support that we need to do our jobs, which is see our patients, and do that efficiently to the point where we can concentrate fully on the patients and not worry about extra paperwork, not worry about calling anybody. So we actually do what we're supposed to do instead of the extra paperwork part, which actually helps us function and a little more efficient. And so we can do exactly what we need to do, which is so important. And like I said, once we do that, we're not sitting around after work filing paperwork, getting bogged down with clutter, and we can get home in a reasonable time. So that's another draw for me, like I mentioned earlier.
Yeah. What are some of the signs have you seen in the past of other physicians when they get burnout? Do you know what those would look like to help physicians to stay away from that?
In general, a lot of this is fatigue, frustration, anger, resentment, bitterness. It sounds like a marriage, right? It's similar because your thought process is different. You're taking shortcuts. All of that stuff is on par right now, and you just really have to be very careful of that. And it's a very negative down spiral. So having the extra part about hobbies that you have, so Louisiana, the fisherman's paradise, right?
Yeah.
Hunting and all that kind of stuff. I've started doing that recently too, which is fun. It's a good outsource. There's a lot of things for the kids to do, and travel is not bad. It's easy. Lafayette's got a new airport, so you can get out to anywhere you need to. So we have everything that we need. Everything's just been moving in the right direction for us.
So interesting, because you said two things. We talked about the spouse being happy, right? And then you talked about work being like a marriage, right? We spend more time at work than at home sometimes. And so I think communication is key. When things are getting frustrated or not the way you want it to be done, I would suggest effectively communicating to your manager, to your other colleagues, so that things can be worked out, right?
Day-to-day clinic, just how many patients you have on your list, or how they function, how they're worked up, all that stuff is like a routine. And so if you don't advise or you don't educate the nurses, you don't talk to your practice manager, then it becomes a challenge, and the frustration will set in. Yeah. And then the line of negativity continues, and it was just going to be a bad thing. So there's always an open dialogue with us, with our practice managers. We always have check-ins and say, hey, look, do you need anything? What can be different? What can we do better? Yeah. It's that constant kind of feedback that we have with the team, which helps move us in the right direction.
Yeah. And in addition to that, you have your nurses and the staff that works with you on a daily basis. Right. So again, back to the marriage piece, educating them and making sure they understand how you like to practice, I would imagine helps with reducing that burnout and that frustration, not only on your level, but their level, and everyone goes home happy at the end of the day. Is that a fair statement?
It's a very fair statement. Having a great team behind you makes all the difference in the world. Whether you're in clinic, whether you're in the cath lab, whether you're playing soccer, it makes a huge difference everywhere, right? And so having that support staff, which is bountiful for us, which just makes our life easier. It is, and then you actually have a good time at work. You're laughing, you're having good fun. You get through some tough times, you get through some great times. It is a marriage, like you said. You just have to work through it. But yeah, I totally agree with that statement.
And I definitely agree that the more that we all work hard and work together, at the end of the day, the patient is the one that's going to benefit from it all. And then you'll just continue to get more patients from there.
Correct.
You focus on that, and ultimately everything else comes. The compensation, all the other things that you're trying to look for that are good in your life.
Yeah. You do good work, good things will happen.
Thank you, Dr. Amin. It was a pleasure talking with you. I hope our audience today learned a few things about what to look for in a practice, how to stay happy in the practice, and just some good tips. So it's been a pleasure, and I appreciate your time today.
Awesome. Thanks, Michelle.
Thank you for tuning in today for our In Circulation podcast. We hope you enjoyed listening and learning a few things, and we hope that you will join us in the future. Enjoy the rest of your day.